Alrighty. Alrighty, so hi, good afternoon, good morning, whichever one it is. My name is Alejandra. I will be presenting on polycystic ovary syndrome. Let's see. Okay, so just a quick overview of some things I'll be talking about. I'll be going over an introduction to polycystic ovary syndrome, or otherwise known as PCOS for short. I'll be going over diagnosis for PCOS. We'll be talking about some risk factors, treatment options available, and prognosis for someone who has PCOS. And then just really quick, I will be using, for the most part, the term women. However, I will also be using a more gender neutral term like people with a uterus, given that some folks might not identify as women, but might still have a uterus and so might also be, at risk for PCOS. Alrighty. So before I get started, I wanted to do a cool little just did you know, right? Fun facts about PCOS. So the first one is, PCOS is an endocrine disorder. However, and it's a very common endocrine disorder in women, again, in people with a uterus. However, funding is really low, right? It's less than 1% from the National Institutes of Health. And so, despite this being a very common disorder, there is not a lot of funding for it. So a little sad, but good to know that that's where we're at, and the challenge is that perhaps research, right, to find a better options for treatment and cures and so on and so forth. Another fun did you know is that although PCOS primarily, and I'll talk a little bit about this, a common symptom can be cyst in ovaries. Not all women or people with a uterus who have PCOS will have cysts, right? And so although this is a very common symptom, it's in the title, it's in the name, this is not always the case for someone who has PCOS. Also, PCOS is one of the most common causes of infertility. Like I mentioned, it is an endocrine disorder, affects our hormones. And so, although there's very many other reasons why someone may be infertile, this is one of the common disorders. And then around less than 50% of women or people with a uterus are properly diagnosed with PCOS. And I'll talk a little bit about why this is the case. Alrighty, so what is polycystic ovary syndrome, right? PCOS is a common endocrine disorder, like I mentioned, affects our hormones or androgen hormones that are usually responsible for ovulation, right? The release of an egg from an ovary. Again, like I mentioned, it affects women or people with a uterus. And like I mentioned, it's a very common endocrine disorder, affects 5 to 10% of women or people with a uterus in the United States. So this is about 1 in 10, right? And so it's a very common disorder. The cause is really unclear. However, scientists have linked it to heredity, abnormalities in hormones, and even environmental factors. So, for example, if someone like a relative, right, most likely, an aunt or a sister has PCOS, then that person is more likely to have PCOS as well. Some common symptoms include irregular periods. So someone with PCOS might not be having regular periods, and this is primarily due to the fact that if they have cysts in their ovaries, right, that kind of disturbs ovulation. And when there's a disturbance to ovulation, your lining of the uterus is not shedding the blood that it's supposed to properly, right, when you have a regular menstrual cycle or menstrual period. And so this may be one of the causes why someone misses a period or doesn't have a period, right? Or can have heavy periods. It all really depends, like I mentioned. But again, right, someone who has PCOS might not even be missing a period because they don't have any cysts in their ovaries. So again, it's all depending on the individual and their symptoms. Another symptom is called, I always mispronounce it, hirsutism. Sorry if I'm mispronouncing it. And this is an increase in body or facial hair. And so this has to do with excess increase in body hair, facial hair that's not normally happening, right? We like to associate this with more of like a male characteristic. Again, for the reason of being gender neutral, this is just because there's a higher production of testosterone, right? And so someone who identifies as a woman or has body parts associated with the female reproductive system, this might be out of the ordinary. But again, right, this is not the case for everybody. Another symptom can be acne, right? And this again has to do with the imbalance in the hormones. Weight gain, right? The imbalance in hormones then affects metabolism, right? And metabolic processes and imbalances and infertility, right? If there's no ovulation occurring, then infertility can be a really big effect, right, of someone who has PCOS. And so we'll talk a little bit about what that looks like in terms of treatment later on. And like I mentioned, cysts around ovaries and mood swings. Alrighty, so what does diagnosis look like for someone who has PCOS? One of the first things perhaps would be blood work, right? Ideally, when an individual comes in to see the doctor might be able to notice some physical things going on in the body, perhaps, seeing excess hair. In terms of blood work, like I mentioned, they might be checking, right, for abnormalities, or want to make sure that the changes associated with irregular periods and things like that have to do with androgen hormone and not necessarily maybe like a thyroid problem, right, or even pregnancy or something like that. And so it's really important to really identify the difference and know that it's associated with an increase in androgen hormone. Also a pelvic ultrasound, and this is to be able to get an image of the ovaries and be able to determine if there's cysts around the ovaries. And as you can see here in the image, a pelvic exam, and this can be, this is done by a physician, a provider, and this is where they insert their fingers inside the vaginal canal in order to determine if there's a growth of the clitoris, and this usually is also able to identify an increase in testosterone. And so those are some indications, and other indications in terms of physical exam, like I mentioned, body hair increase, facial hair increase, but also acne, right? That's something that's visible and we can see, and we can also use to identify PCOS. One thing I wanted to know is that diagnosis can be done prior to first menstrual period. And I just like to mention this because sometimes, if we're talking about irregular periods, we're kind of like, oh, well, how do we know, if they never had their period? And so there's other various symptoms, right? Blood work, again, trying to determine whether androgen hormone is excess, right? Some other ways to determine is studies have shown that if youth or young people from the age 8 and younger are already starting to have grown in, facial hair, body hair, they might be at higher risk to get PCOS. And so that can be an indication to diagnosing PCOS early on, or, just kind of being mindful of that. This might be something to keep an eye out. Alrighty, so what to rule out? Like I mentioned, right, there's a few things that we would want to rule out, and this is just so we can be able to identify that what we're looking for in this person is PCOS and not something else. So like I mentioned, pregnancy, right? Some of the symptoms, not all of them, can be associated with pregnancy, right? And again, if someone does have PCOS and they are pregnant, that's okay. However, they'll have to be monitored because they could be at risk, and their baby could also be at risk for things like preeclampsia, right? Gestational diabetes, and I'll talk a little bit about insulin resistance. And so another thing we want to rule out is thyroid gland problems, right? This can also indicate a hormonal imbalance. And so that's something we also want to rule out and make sure that, irregular periods or excess in hair growth and things of that sort are not related to a problem with your thyroid gland. Also, adrenal gland causing androgen overproduction, so our adrenal gland can also be a cause for that. And so wanting to really identify that the reason why there's an increase in androgen production, right, is associated to ovulation and so on and so forth. And then Cushing syndrome can also be something that we want to rule out. An increase in prolactin production. Alrighty, some risk factors for PCOS. Genetics, like I mentioned, if you have a family member, specifically an immediate family member, like a mom, sister, aunt, you're more likely to have PCOS. Also, if you, like I mentioned, if you have an overproduction of AMH hormone, and so this would also be a good identification in terms of knowing that this is associated with PCOS. Also stress, right? We know stress affects our bodies in various different ways. And one of the ways that it can affect us is in our hormonal and metabolic processes. And so being mindful of, our stress levels. Insulin resistance, like I mentioned, so insulin resistance and diabetes can go hand in hand with PCOS. There's some physicians and providers who actually say this is causing PCOS, right? A lot of providers go back and forth as this being a symptom or being a cause or being a risk factor. And so this is just something to keep in mind, right? In this case, right, the overproduction of androgen hormones is associated with, also insulin resistance and insulin not being able to do its job in our body, which is to balance, our glucose levels. And so this in itself is can put someone at high risk for diabetes, right? And so something to keep in mind, if someone is overweight or obese, this could definitely be a risk factor for someone to get PCOS. Like I mentioned, weight gain, right? Can also be associated with stress. And sleep problems, right? So essentially, just taking care of yourself, making sure that someone is taking care of themselves, getting adequate sleep, reducing stress levels, and eating a well, healthy, balanced diet. However, we do understand that, sometimes it's difficult, and we also want to be mindful of, social determinants of health and how there's many different reasons as to why our patients can't access healthy food, right? Or whether their environment causes stress, right? And so there's various different factors into why someone may be stressed or may not have the ability to have healthy food, right? Or why someone might not be able to access preventative health due to no access of healthcare, right? And so different risk factors that can affect someone's risk to getting PCOS, but we also want to be mindful of exterior factors that can be a reason why someone has risk factors, right? And so just something to keep in mind. So in terms of treatment, so for PCOS, unfortunately, there is no cure. However, it can be managed, right? As you can see in the image here, one of the most common ways to treat PCOS or manage PCOS is birth control pills or oral contraceptives. And this can be in the form of a birth control pill, the ring, the IUD, right? Whichever option the provider recommends and is best for that individual. Also, insulin sensitizing drugs, and this is again to help insulin do its job in our body and be able to regulate our blood glucose levels. In vitro fertilization, right? This can be an option for infertility. If someone who has PCOS is looking to get pregnant, right? In vitro fertilization can be an option in which, a provider will, grab an egg from that individual and their partner's sperm, and in a lab cause fertilization and then be able to place a fertilized egg back into that person's uterus. Other options are ovulation inducing medication, right? And this is again to promote ovulation so that person can get pregnant. Exercise, like I mentioned, right? Exercising and eating healthy are very important, and this is to prevent the person from getting things like diabetes, right, and other cardiovascular diseases that are associated with, either what's it called? Unhealthy behaviors like eating high fats, right? Things of that sort. And weight management, right? So these are all, again, things to keep in mind, help your patient keep in mind in terms of how to take care of themselves. But again, like I mentioned, this has to do also with other factors, like if someone's unable to access healthy food, it's very difficult to have that conversation and say, oh, well, you need to have healthy food, you need to eat healthy. But they could be living in a food desert where they have no access to healthy food, and this can pose a challenge, right? So being mindful of those things and what resources our patients need is also very important. Another quick thing I want to mention, as you can see here in this image, right, birth control can obviously help manage irregular periods, right? But it can also alleviate some other symptoms, right? Like acne or hair loss. And of course, right, unwanted pregnancy, a person might not want to get pregnant, right? And so this could kind of be killing two birds with one stone. And a person can be preventing pregnancy, but also could be helping with their PCOS symptoms. And one last thing I forgot to mention was for excess hair on the body or facial hair, a treatment option for that can be electrolysis or laser hair removal. These are two options. Laser hair removal is a more short-term option versus electrolysis is a more long-term option where it's more permanent compared to laser hair removal. So again, right, depending on what the individual wants, is comfortable with, and whatever seems best for their needs and their symptoms. Alrighty, and so, kind of tying it all together, we talked a little bit about some of the risk factors. These are more risks that can pose onto someone who has PCOS, and so someone with PCOS has a higher risk of diabetes, heart attack, depression, right? Depression and anxiety. This can happen at any stage, right? Because PCOS can affect anybody, but also wanting to keep in mind our young people, our teens, right? Who might be also going through other changes, right? Puberty, and this can really put toll on their mental health. So keeping in mind of that. And also cancer, right? Someone with PCOS might be at higher risk for endometrial cancer. And so, like I mentioned before, right, oral contraceptive is also a good tool in order to prevent something like endometrial cancer. And then lastly, right, prognosis for someone with PCOS, just kind of understanding that this condition is long-term. However, there's have been some studies that show that someone who's actively taking care of their health, right, whether it's through exercise, diet, weight management, can potentially regulate their hormonal and metabolic processes in order to get them where they need it to be, right? Perhaps someone undergoing all those different treatment options that I mentioned can really be key in terms of what this person's diagnosis looks like in the future, right? And like I mentioned, right, health risk can be minimized with proper management of some symptoms, And then, of course, right, knowledge about PCOS increases adherence to treatment. So making sure that, patients know what this is and how it affects their bodies, and making sure that they understand really what's going on, and what they can do, right? What's manageable for them. Is really good in terms of, being able to encourage them to either take medications that support them, or have these lifestyle changes that are also going to support them. And that's it. Thank you so much for listening. Bye-bye.